Hi, everyone. If you're new here, my name's Bailey. I'm a therapist getting my doctorate in counseling psychology. Welcome to my new series, Therapy Explained. My hope for this series is that it will clear up some of the confusions around therapy, it'll clear up some of the mysteries around therapy, and it will help you understand why therapists are the way that we are, why we say the things that we say, and why we do the things that we do. Just a brief disclaimer that this is all based off of my own clinical experience and might not apply to every clinician or therapist you work with. So, without further ado, let's get into it. One of the biggest reasons that people don't end up going to therapy is not because they don't need it, but because they don't exactly understand what it is or what it's for. Most people assume that therapy is just for people who have severe mental health problems or are very unwell. And while that is true, it's not always the case. You don't have to have a diagnosis to deserve help. If you're trying to figure out whether or not you should go to therapy, my question for you is, do you feel stuck? That's one of the main things that indicates to me that therapy might be really helpful. If you're feeling stuck and you don't know why, you don't know how to change or fix it, or yeah, you're just feeling kind of like stagnant. This could also look like being stuck in certain patterns, right? So, certain patterns of unhealthy relationships that you find yourself getting into, you're stuck in a situation that you don't want to be in, but you don't know why you can't get yourself out of. If your mental health is very situational and depends on everything in your life kind of being lined up correctly, that might be a really good time to get into therapy and do some preventative work because things are not always going to be smooth sailing. And therapy can help people build mental resilience, which is a hugely important skill for your entire life. A lot of people who have been dealing with something like depression, for example, for a really long time, they might not realize that things can feel different. So, full disclosure, I have been diagnosed with OCD. I thought, number one, for a really long time, I thought it was normal and everyone felt like that. And number two, I didn't think that I could ever feel different. I thought it was just part of my personality and that was the way I am. But I had to get unwell enough to seek help. And I wish that someone would have told me earlier that I don't have to feel this way all the time. It's not how people have to live. Just because you've suffered for a really long time and you've gotten used to it doesn't mean that therapy is not going to help you or won't work for you. It just means that you've grown accustomed to something that you shouldn't have to. Sometimes therapy isn't a good fit. And I know people say that, everyone needs therapy. And to some extent, I can see how that might be true, right? A lot of people are walking around with things that they don't know about themselves, or if they worked on a little bit, it could greatly improve their life. But therapy is not, in my opinion, actually, this is all my opinion, so I don't know why I'm qualifying it that way. It will be very difficult to do therapy if there's nothing in your life that you feel like you want to change. So, if you are unhappy with your life and there's nothing about it that you want to be different, you just want to feel different and not do anything differently, therapy is probably not going to work for you and you're going to feel very annoyed with a therapist. It varies person to person, but the point of therapy is not to just have someone to tell about what happened in your week and then leave. Therapy is about creating change and making meaningful differences in your life. That might take a really long time, so it might feel like you're just coming in and saying what's been happening week to week, but it's all geared towards change, regardless of how quickly or slowly that happens. So if I have a client I'm working with and they're telling me that there's nothing they really want to change, I might kind of help them consider that therapy might not be right for them right now. If you don't want to change anything, then a therapist is not going to be very helpful to you. Therapy is uncomfortable. And the reason it's uncomfortable is because change is uncomfortable. If you're not willing to be uncomfortable, then you're not really willing to do therapy. This is no moral judgment on whether or not you're willing to change or whether or not you're willing to feel uncomfortable. Either way, I don't really care, do you? But I just want to let you know that if someone comes into therapy and they don't want to change and they don't want to feel uncomfortable, it's a pretty good sign to me that therapy is probably not right for them at the moment. We try our best to make things feel very safe, but that doesn't mean we try and make things feel very comfortable. If you're watching this video and some of these things feel accurate for you, but you're skeptical that therapy can help you at all, that's totally normal. A lot of people come into therapy, tell me what's going on for them, and then say, I don't know how you can help me. But it's not your job to know how therapy works or how I can help you. That's my job. And if I don't think I can help you, I'm going to tell you that, right? Like, if I think that it is beyond my scope, I will let you know. But you don't need to know how or if or why therapy might work for you. That's not your job. That's my job. All you need to do, show up, let me know what's going on for you, let me know what you want to change, and we can move forward from there. I hope this gave you a little more clarity into how to know if you might need therapy. The next video I'm going to be doing will be on the intake session, which is the first therapy session you do when you come in to meet with someone new. If you're interested in content like this, or you're interested in hearing reviews of self-help books, please consider subscribing to my channel. It means a ton. I'm still very new to YouTube, so it's helpful to know that people are interested in this kind of content. See you in the next one. Bye.